This video has been funded through an educational grant by Sanofi Ltd. Sanofi has had no input towards the content of the video or the interviews. Cold agglutinin disease, or CAD, is a rare, complement-dependent disorder affecting between 5 and 20 people per million. Patient advocate groups, including the CAD Foundation, help connect those affected by the disease. In this conversation with Banta from the CAD Foundation, we started with a discussion of how the Foundation works to help educate patients and their healthcare providers.
When you get diagnosed with this, I'm going to get emotional. You don't know anybody else who has it. It's not hereditary, so no family members have it, no friends have it, and it's bizarre. It's kind of a bizarre disease. CAD Foundation saved me. You can relate to people who are going through the same thing that you are. Being locked in your house in the winter by yourself is extremely isolating. But that's the beautiful thing about technology. Zoom was wonderful. We could do the webinars, and that's the way we do webinars, and we can reach people all over the world, which is lovely. Since it's a rare disease and there are a few of us, we can really talk with one another. And then it's wonderful to share our experiences. We can talk about treatments. We can talk about research opportunities and studies, which these things make me very hopeful. Having NJMO available makes me very hopeful. There are a lot of patients that none of the off-label treatments worked for, and it's been fantastic. It wasn't available when I first got treated, so I used a B-cell treatment, but we know that those only last for so long. But I know that this treatment's available.
How do you navigate conversations with your general practitioner?
When you talk with your doctor, it's really important to express descriptively what's going on with you. I made this mistake. He'd ask me how I'm feeling, and I might say, I was tired yesterday, I'm fine today. What I really should have been saying is, I no longer have the energy to change the sheets on the bed by myself. When I get up in the morning, if I make breakfast and brush my teeth and take a shower, I'm done for the day. And no matter how much I rest through the day, I don't have enough energy to make dinner and clean the dishes. That's a devastating way to live. So I can't do my chores, and then I can't do all the things that I love, like gardening. So realistically, what kind of treatment will help me to be able to regain some of my ability to take care of my house, do some of the things I love, or work?
What treatment options are available, and how do they affect CAD patients?
There are different kinds of treatment that have different focuses. There's reduction of B cells, that kind of treatment. There's controlling the complement. So, and JMO is the only FDA approved treatment, and that stops hemolysis. So if you're really low and you need immediate increase in hemoglobin, that's the way to go. If it's more bothersome, some of the symptoms, but you're not having horrible hemolysis and low hemoglobin, you may want a B cell treatment. Those are off-label, but they are available. But then you need to ask the doctor also, what are the side effects and how is this going to change my life? Um, with certain of these drugs, they affect your immune system. And for some of the B cell treatments, it can be 3 to 6 months to a year. Since infections adversely affect us, if your immune system's compromised, then you're going to need to take measures and steps, which could include not going to social functions or wearing an N95 mask, those types of things, or just going to functions that are outdoors, not indoors. Um, and so I think that you have to have really good discussions with the doctor and have them explain everything about the treatments.
What difference does prior experience with CAD make for healthcare professionals taking on new patients?
It's extremely difficult to find a hematologist who knows about cold agglutinin disease. Um, and when I was first diagnosed, there wasn't a list, but on the Cold Agglutinin Disease Foundation website, we have a list of specialists by state and also by country. And this list was developed from cold agglutinin disease patients who are recommending their doctors. And primarily, you want to see a hematology oncologist. If you can find a hematologist who's an expert in autoimmune hemolytic anemias or a rare disease, blood disease specialist, that is excellent. People should always ask their doctor when they go in, have you heard of CAD? How many cold agglutinin disease patients have you treated? Um, or you can say, what do you know about, if you've heard of it, what do you know about cold agglutinin disease? But you should always, when you have a rare condition, be asking your physician, what do you know about the condition? How many people have you treated? Two, in the emergency room visit, you need to reiterate that they cannot use ice. That's a hard concept. Even for the doctors who I've explained my condition, I have to continually remind them, cannot use ice on inflammation. Um, had a horrible hornet's nest, or run in with a hornet's nest this summer, and I blew up. And no, I cannot put ice on that.
What advice would you give to those just starting their CAD treatments?
We really have to be self advocates, and the other portion of that is standard medical procedures don't work for us. We can't be treated with ice or cooling blankets. If we get blood transfusions or get IV fluids, they have to be warmed. It could be very dangerous for us if they're injecting us with cool liquids. Blood testing is particularly difficult, and if you don't have accurate results, that can really affect how you're treated. Most phlebotomists and lab techs do not understand that the test tubes need to be pre-warmed before the blood's collected. And so they usually do that with baby heel warmers. Then they have to keep the samples warm by the time they get it to the lab. And the tests have to be run immediately. They can't sit. They cannot be put in the refrigerator. Agglutination, or I call it clumping, happens. And that will greatly distort the blood tests. They won't come out properly. You need to be prepared. You need a medical ID band. And what I recommend is that you have cold agglutinin disease on there, put no ice, keep me warm, IV fluids and blood uh, need to be warmed. You need to have that information. I wear this all the time. Um, and then, of course, someone to contact, with a phone number on there. I also, in my purse, have written information on cold agglutinin disease, and then you can get blood cards that say I have cold agglutinin disease, and it specifies that the collection procedures, warming the test tube, all that needs to be done. And you can get those from Sanofi's website has those, um, the Cold Agglutinin Disease Foundation website. So I believe Sanofi has an excellent website called CAD Unraveled. Um, and they have a lot of documents there, and Cold Agglutinin Disease Foundation has a lot of supportive documents. Um, and then it's important for your family, friends, partners to be educated on cold agglutinin disease. They're your support, and physically, emotionally, mentally, socially. And it can be very discouraging when you have this disease and a family member says, well, just put on a sweater, you'll be fine. You have to really educate them about the intricacies of cold agglutinin disease and have them ready to advocate for you. If you go to the emergency room and you're able to speak, you need to inform everybody you come in contact with, I have cold agglutinin disease. Have you heard of it? This is what you need to know about it. If they don't have a blood warmer, ask them if they have uh, warming blankets. You can wrap the IV bags in um, a warm blanket. I've had that done. I had to have a colonoscopy at the hospital. Um, they didn't have a warmer, but also know the plasmapheresis department in a hospital always has a blood warmer. So um, you can say, I know you've got a blood warmer, go to the plasmapheresis department. Um, so that's for an emergency room situation. If you're going to have surgery, a planned surgery, or like my colonoscopy, they wanted to do my colonoscopy at their center. And I started asking because all these places, they keep cold. And air conditioning is just as bad for us as being out in cold temperatures in the winter. If you're having problems, you do have to be assertive and ask to speak to the lab manager. I know, and this is where, our Facebook page comes in great. We can privately have conversations about, have you had this problem? What have you done to try to work through this? So many people have said that they develop a relationship with the lab manager, contact them ahead of time so that they are prepared for when people come in.
How does the CAD Foundation help healthcare providers with their professional development?
For doctors, please help your patients find networks. Don't just say stay warm. Try to do a little more research. There's lots available. Um, there's wonderful information out there, and within a short period of time, you can increase your knowledge about the disease. And remember, you and your doctor are a team in this. You all have to work together. Doctors and medical professionals have to take courses to maintain their licenses. So we've been getting involved with some of these companies who provide that education, or organizations who provide that education to improve the knowledge of medical personnel. So I just really see it continuing to grow and expand, and I'm extremely hopeful for our community in the future.